Now I'd like to take someone up to the podium who has been a strong partner in forging a strong Texas since he took over as Lieutenant Governor, David Dewhurst. Governor.
Governor, thank you, and Senator Cornyn, Senator Cruz, thank you for being here. I think we're here today because we want to make sure that at the end of the day we save Medicaid and its ability to take care of and help the elderly, frail, disabled, and children. As Governor Perry said 4 years ago, President Obama said that our current Medicaid system is broken. Well, I agree with him. It's one of the few things I do agree with him on. It is broken. Our Medicaid cost here in Texas over the period between 2000 and 2010 went up over 130%. That 13% per year is now crowding out spending on public education and higher education and prisons and public safety and building roads. The current Medicaid system is threatening to bankrupt not only the state of Texas, but every other state in the country. And here we have the Obama administration, which is now saying, well, maybe we can send over 10 years $100 billion into Texas. That's nonsense. They're not going to be able to do that. They can't fund their current bills right now. I mean, would you consider expanding a broken system? Of course not. Of course not. It's like a drug dealer. You give them your first hit free, and then they're hooked for years and years. Governor Perry and I have been on the receiving end from Washington on the front lines working to stop these unfunded mandates. And we appreciate our partners in Washington, Senator Cornyn and Senator Cruz, fighting for a Texas solution to our problem. We've said no to Obamacare, and we're saying no to expanding a system that's broken unless we can find a way to fix it. I'm not sure we can. The last 7 years, I've been working on free market permissive solutions to Medicaid and to health care. That's why I'm pleased that in 2011 we passed Senate Bill 7 with the help of Senator Nelson, which allows pay for performance in health care plans, incentives for doctors to follow best practices and keep patients out of hospitals. And this year, again, working with Senator Nelson, we were able to pass a new Senate Bill 7 that does some of the same things for Medicaid by empowering our managed care companies, requiring them to provide for healthier Texans, and if they don't, their financial penalties. Medicaid's a broken system, and expanding it will only make it worse. You know the old adage, one size doesn't fit all, doesn't fit here. I think we as state leaders need to stand together and say that Washington needs to give Texas the flexibility it needs to develop a Texas solution to the expanding healthcare crisis in America. Just like we're recommending the Texas solution to getting Americans back to work and jobs.